Hello viewers, welcome back to my YouTube channel. My name is Mohammad Sohil and today we are going to learn new topic or saying nervous system disease, that is epilepsy. So without any further delay, let's begin with our today's session. First of all, coming to the introduction. Epilepsy is a disorder of the brain characterized by repeated seizures. A seizure is usually defined as a sudden alteration of behavior due to temporary change in the electrical functioning of the brain. Now coming to the causes of epilepsy. First, primary causes. It includes childhood epilepsy, genetics, head trauma, cerebrovascular diseases, brain tumor, CNS infection, that is central nervous system infection, then Alzheimer diseases. Then secondary causes include ischemia, drug overdose, hypoglycemia, hypomagnesemia, then hepatic failure, and last is renal failure. So these are the causes of epilepsy. Now coming to the pathophysiology of epilepsy. One common thing across epilepsy is a disrupted balance between excitatory and inhibitory balance drive at the synaptic level that can result in seizure activity. Then coming to the classification of epilepsy or types of epilepsy. First, partial epilepsy. It includes simple partial epilepsy and complex partial epilepsy. Then second is generalized epilepsy. It include grand mal, petit mal, myoclonic, tonic, atonic epilepsy. So these are the types of epilepsy. First, partial epilepsy. It is also known as focal seizures. Focal or partial seizures occurs when seizure activity is limited to a part of one brain hemisphere. There is a site or a focus in the brain where the seizure begins. Partial epilepsy is again divided into two types, that is simple partial epilepsy and complex partial epilepsy. Coming to first, that is simple partial epilepsy. Focal seizure with retained awareness. This type of focal seizure was previously known as a simple partial seizure. Symptoms include jerking of limb or face, then twitching of part of body, and no loss of consciousness. Now coming to second, that is complex partial epilepsy. Focal seizure with a loss of awareness. This type of focal seizure may also be called as complex partial seizure. Symptoms include automatic chewing movement, performing aimless activities, and last is acting in a confused manner. So this is all about the simple partial epilepsy and complex partial epilepsy. Now coming to the second type or second class of epilepsy, that is generalized epilepsy. It is also known as generalized seizure. A generalized seizure occurs when both halves of the brain have epileptic activity. The patient consciousness is lost while the seizure is in progress. Generalized epilepsy include various parts or various type. First, grand mal epilepsy, second, petit mal epilepsy, third, myoclonic epilepsy, fourth, tonic, and fifth is atonic epilepsy. Let's discuss one by one. First, grand mal epilepsy, which is also called as tonic-clonic seizures. Grand mal epilepsy is most common. Without warning, patient suddenly goes stiff, falls, and convulsions. It includes difficulty in breathing and increased salivation. Then second, petit mal. It also known as absence of seizures. It occurs in childhood and early adolescence. Child goes blank, stares, fluttering of eyelids, etc. It lasts for few seconds. Then myoclonic seizures or myoclonic epilepsy. They are very brief involuntary shock like jerks involving whole body, arms or head. It usually occurs in morning. Now coming to the diagnosis of epilepsy. First, physical exam, that is medical history checking. Then second, neurological test. Third, blood test. Fourth, ECG, that is electrocardiogram. Then fifth is electroencephalogram. Then magnetoencephalography, that is MEG. then computerized tomography, that is CT scan, and second last is magnetic resonance imaging, that is MRI, and last is positron emission tomography, that is PET. So these are the diagnostic tests of epilepsy. Now coming to the management of epilepsy. Epilepsy is usually treated with medications, but it may also involve surgery, nerve stimulation devices, or special diets, depending on your situation and whether or not your seizures are controlled with medication. Then this image shows the current treatment of epilepsy. It includes anti-epileptic drug, that is AED. Then you have to improve your diet. If this not work for you, then you have to go for surgery. Now coming to the drug classification which help the patient to treat epilepsy. It include barbiturate, and the drug which comes under this class is phenobarbital. Then doxybarbiturate, and the drug which comes under this class is primidone. Third, hydantoin, and the drug is phenytoin, etc. Now coming to the anti-seizure drugs. It includes four classes. First, tonic-clonic and partial seizures. Then second, absence seizure. Third, broad spectrum classification, and fourth is adjunct. Tonic-clonic seizure include carbamazepine, phenytoin, phenobarbital, and broad spectrum. Then absence seizure include ethosuximide and broad spectrum. Third, broad spectrum include valproic acid, that is clonazepam, and adjunct include lamotrigine and gabapentin. Now coming to the preventive measures of epilepsy. Step to help prevent seizure. First, don't drink alcohol, use illegal drugs, or smoke. Protect your head with a helmet during any sport or activity that could result in a head injury. Third, get plenty or sleep every night. Fourth, do your best to avoid getting a cold or the flu. Then talk with your doctor about all of your prescription medication to be sure they won't aggravate seizures. Then always take all of your epilepsy medication as prescribed. Don't take OTC medication for this. Then find healthy ways to cope with stress. So these are the preventive measures for epilepsy. Then the last treatment option for the patient of epilepsy is surgery. For some people, surgery can stop or reduce the number of seizures they have. It might be considered if anti-epileptic drugs have not stopped or significantly reduced the number of seizures of a person has. There are different kind of epilepsy surgery. One kind of surgery involves removing a specific area of the brain which is thought to be causing the seizure. Another kind involves separating the part of the brain that is causing seizure from the rest of the brain. So this is all about the epilepsy.